Hi everybody! TTC Diva again. I have an update. Okay, so I'm on cycle day 52. We have no amp flow, no nothing. Um, so let's see, I think where I left off was that I was going to go to the doctor and see what's going on. And we did some blood work. We did a pregnancy test and it came out negative, and my progesterone was also low. So yesterday I went to the doctor again, and just to discuss what our plan should be as far as the low progesterone and things, and why I may have skipped or not ovulated. And so then, as we were waiting in the, I don't know what to call it, patient room, I guess, um, my husband and I were sitting there, and we hear a baby's heartbeat in the other room. I don't think that you can hear those things. At least I never have. And to hear that, my husband was like, "What is that?" And I was like, "It's a baby's heartbeat." And he was like so happy. It just looked like he was, I don't know. It changed things for him a little bit. So he seems to be, to me, a little bit more motivated and everything. So enough to, and I'll let you know in a second, do something that he talked about not doing before. So excited. Okay, so what happened at the doctor? She told me, she's like, let me tell you about progesterone. Progesterone, you only get it after you've ovulated. Well, mine was low because why? I didn't ovulate. So she then prescribed me Provera to kind of trick the body into thinking that I've ovulated and hopefully Aunt Flo will start. So that'd be fabulous. But again, of course, you guys know I'm looking at my notes. Um, so, and I try to stay away from it, and forever I've been away from it, but now I'm back on it, metformin. So I'm on metformin now, twice a day, so 1,000 milligrams, and then we're just on it for a trial. So we're gonna see where that takes us as far as the cycles going and such. So she said she's gonna be keeping a very close eye on me and my cycles. So that I'm kind of happy about, because usually when I go see her, she'll do a little bit here and then we'll do a little bit here. But I guess since she knows that we're trying to have a baby, she's gonna watch me more closely and get things on time and make sure that there's not any other issues, you know. So I'm excited about that. I'm actually pretty happy about taking the metformin. Although today is my first day I've been on it, and I was really really sleepy. So I don't know if that was just because of me or because of the metformin. I feel kind of drained. So I don't know what's going on with that. Um, let's see. Oh, and for husband, she suggests that he go to the urologist. She did suggest that before, but he was not about it. He was not gonna do it, and he was gonna. That's why we tried the Fertilate. Well, even though the Fertilate he's been taking it for a month now, and it seems to be improving things. And we did tell her about it, and she didn't know what it was. I've noticed that a lot of doctors really don't know what Fertilate is, and we had one doctor tell us it's probably because it's an all natural thing, and usually, um, if it's all natural, companies aren't really going to come to them and say things about it. That's what we were told. Could be completely wrong, but that's just what we were told. So hubby's going to be going to the urologist. Super excited because he really didn't want to do that. Sorry. He really didn't want to do that. But now he's going to do it. So he's just not a go-to doctor kind of man. So Dr. Willard, or my doctor, really talked to him very well. And she's she's the best doctor. Like, I love her as my OB. She is so informative. She sits down and she takes time to explain things to you, especially the PCOS, because basically that's why I'm in this situation again, is because of my PCOS. She said that it just does that, and I'm just like, ugh. So we blame it on the PCOS. Of course, that darn thing. Because she was constantly talking about my weight. Well, maybe it was my weight that might have done it off. Well, okay, when I was doing it regularly, having my cycles on a normal 28 days and everything, I was actually larger than what I am now. So it wasn't the weight thing. She said it's probably not stress. She said it's probably, could be something just weird. I don't know. So I'm just glad she's keeping an eye on it. But anyway, back to urologist. So he's going to go into the urologist, and that'll be something that we discuss. And in the next video, I'll put it in the next video so that you guys know, how that experience has been. I've never been to a urologist, even office, but she said that the urologist would be very informative as far as hubby's previous surgeries and how that may have affected his low count. So hopefully something effective will happen, that it'll be a quick, well, not quick, but no surgery will have to be involved. We hope, at least. We'll see. So pray about that for me. Let's see. Oh yeah, so I think I had talked previously about wondering if I could ever do a VBAC. Well, I asked my doctor. She said probably a no-go. I've had 2 C-sections, and I guess as far as like me as a patient and what happened to my first son, because we both almost died. It was such a bad experience that she doesn't want to worry about any other complications. So it'd probably be our safest route to have another C-section when we get to that point. So that's just good for me to know, as far as, clearing my mind about things and wondering. So I don't have to wonder anymore. I already know. So that works for me. Let's see. Anything else I need to talk about? Well, so for now, I guess that's it. But I have to continue to keep the carbs low, continue to keep the calories low, which sometimes is a really big pain in the butt, but I work with it. I'm going to be doing the metformin trial, see how that works over a 3-month period, and then the Provera for 10 days to trick the mind as far as a cycle is concerned. And then hubby will be going to the urologist. I think it'll be kind of fun to film hubby going to the urologist, but we'll see what he does. I don't know if he'll do it, but we'll see. And if I do that, it'll be with a phone. So I don't know if you guys want to watch it, but it'll be with a phone. So, and then hopefully next video I'll be like, woohoo, AF finally came, finally. Because this is what, cycle day 52. Ugh, forever. So, until then, I would say baby dust and bunch of love. Bye, everybody.